Welcome to Astella Physiotherapy Clinic, Enugu, here in Nigeria. My name is Chike Choka. I'm the clinical director. Today, we'll be talking about how we manage lower back pain in Astella Clinics. Like I said, I'm the clinical director, and my background is physiotherapy. I'm an endoscope practitioner with special interest or specialization in sports medicine. Lower back pain is one of the disabling conditions being presented in our community. Today we'll be looking at how we manage it here in Astella, our robust approach, things we do to get on top of it. With discussion today, we're going to be looking at the different modalities we use. We tend to use a lot of the current evidence-based treatment modalities, which includes the IDD therapy on acuspinal. This is going to be our main discussion today. We'll also have other modalities such as the low-level lasers, the ultrasound, manual therapy, and also we use exercise-based programs for our patients. So you can see that we basically look at lower back pain as something that needs to be confronted with, and we do that robustly. So we're going to take that step by step, and first of all, we will look at the anatomy of the spine. A look at the anatomy of the spinal column will help us to understand some of the causes of lower back pain. A typical spinal column has a vertebral body, a large vertebral body, and a disc that is a cushion in between the two vertebral bodies allows for movement, as well as a facet joint that allows for rotational and side movement. So there's 7 cervical vertebrae and 12 thoracic vertebrae, as well as 5 lumbar vertebrae in a typical spinal column. The common sites of dysfunction are the 667 at the cervical column and L4, L5 at the lumbar region. The cervical column also has interforaminal space that allows for the nerves to move around. And within that region, there is a disc. The disc could also bulge or prolapse, compressing the nerves and causing pain that goes down, shooting down your leg, which we today call sciatica. And it could be a burning or tingling sensation going down the legs. So within the region of this vertebrae are those discs that I told you about earlier. They're covered by annular fibers that protects the main nucleus pulposus, the gel inside the disc. Now, this fiber can tear under trauma or pressure, causing a bit of leakage at the level, getting into the interforaminal space, which is the which houses the nerve roots. On compressing those nerve roots, you can have a sensation that will send pain all the way down to your leg. If it's severe, it can have issues with your bladder and bowel, and also affect your walking. At this level, that might be what we consider as red flag. But if it doesn't affect it and it's sending just a normal burning sensation down your legs, that could be managed conservatively. The typical disc acts as a cushion in the compression, especially on impact. When we're running or jogging, it tends to cushion the two vertebral bodies so that they don't compress the nerves. Unfortunately, as we age, or due to genetic predisposition or lifestyle, these discs, they tend to wear off. And when they wear off sometimes, the vertebral body in itself could start meeting each other, crushing each other, causing a bit of a pain. And these pains could be excruciating sometimes, that when you're sitting down, the shock absorption that the disc provides is gone. Therefore, the impact on those vertebral bodies becomes severe, and people get more pain when they're seated than when they're standing. And this pain, like we say, can be referring down to the legs, causing you abnormal sensations. The degenerative disc could also cause the facet joint to become also degenerative because it's a load-bearing joint, the facet joint. So they could occur alongside as disc degeneration. And when this happens, there's restrictions in your movement. You're not able to bend forward. It's called stiffness. So these are the things that causes lower back pain. And the main reason is that we need to know about it, is that it will help us to understand how to manage it. In managing lower back pain, most best doctors would recommend a robust conservative management before any invasive intervention such as surgery or spinal injection. Randomized trials suggest that herniated disc responds to treatment that safely and properly manipulate the spine. Neurosurgeons who recognize that serious back pain can often be resolved without surgery develop the IDD therapy in the acute spinal system. IDD therapy is an advanced form of spinal decompression treatment that allows the body to heal without surgery or injection. Treatment section on IDD acute spinal system applies targeted decompression forces at the precise and mathematically calibrated angle based on your body type and diagnosis to create rehabilitating spinal mobilization. The pressure rate gently fluctuates in a serial sort of way pattern, like a pumping movement between the vertebrae, gently repositioning the dysfunctional spinal segment by lowering the intradiscal pressure significantly below 0 millimercuries. This negative pressure inside the disc can work like a vacuum to pull the leaking material back towards into the center of the disc. As dynamic energy and treatments are increasing, so is the space around the injured disc. Surrounding muscle elongation begins. Sensitivity of the nerve fibers are lessened. Segment-specific IDD treatment on acute spinal works to relieve pressure of the injured disc and free up the affected nerve root non-surgically. During the height of your IDD treatment, the second waveform is introduced into the spine oscillation. The acute spinal system also produces oscillation signaling. These micro vibrations seek to alter the nerve pathway communication, also known as proprioception signaling, to enhance actual tissue regeneration at cellular level and further improve nutrient diffusion, which is essential for this repair. Treatment sections are so comfortable, many patients fall asleep. Research studies funded by the National Institute of Health, conducted at Mayo Clinic, as well as others performed by medical doctors associated with Harvard and other leading health institutions, have confirmed dramatic reduction in pain and disability with acute spinal treatment. Pre-post MRI also confirmed how IDD treatment can help disc bulge shrink. Disc dehydration is also evidence on MRI, showing measurable disc height and fluid retention after a full treatment course. In one independent neurosurgical study conducted on over 500 patients who were referred for surgery, 92% achieved relief without surgery. The acute spinal is the only spinal therapy and decompression system to win patent after patent for exceptional capability. Patients have reported pain-free a year after treatment. Now you can restore performance of a heel their spine without the high risk and expense of surgery. Now ask your doctor if you are a good candidate for acute spinal treatment, one of the most studied safest treatment for surgical intervention. Visit Astella Physiotherapy Clinic, Enugu in Nigeria for quality IDD treatment. And thank you for listening.